Okay, good afternoon again. My name is Joaquin Machado. I'm the Director of Nursing at Serenity Walks Wellness Center in Fort Lauderdale, Florida. And this afternoon, we will talk about HIV and AIDS, education, and what is the prevention program we have to follow to try to control this epidemic. In healthcare, because our intimate contact with patients, it is important for us to know about this epidemic. Besides that, we need to be educated also as citizens to prevent the infection. As a healthcare worker, we need to know how to protect ourselves, our co-workers, and our patients. HIV, as we know, is a viral infection, but a virus that has specific characteristics that made the virus very difficult to be eliminated and combat. Why? Because it's a retrovirus that mutates and makes difficult for us to create, for example, a vaccine that may produce antibodies, and the antibodies attack the virus. Why? Because the virus will be presenting in different shapes. Let's say shapes because mutates. The different mutations and different changes in the structure of the virus make very difficult for us to create a vaccine. But at this moment, what do we have available to combat this epidemic? Prevention and, of course, treatments that are being more effective ultimately to control the infection after the individual is already infected. As everybody knows, this is a life-threatening infection, attacks specifically the immune system, and makes the individual exposed to infection because the mechanisms of defense coming from the lymphocytes will be deeply affected. Big part of our immune system or our immune response is coming from the T lymphocytes. And there are different types, but all of them, they work together. What is the problem with this virus? The virus is a parasite that attacks cells. Viruses are very rudimentary structures that they cannot survive by themselves. They need a superior organism, in this case a cell, that they can infect, and they will reproduce there, they will feed themselves there, they will survive there. Without infecting a cell, without getting into the structure of a cell, the virus cannot survive because they are very rudimentary structures. And the HIV virus is not an exception. That's why targets the T cells, attack and infect the cell. After the cell is infected, because the genetic material of the virus is incorporated into the cell loses its ability to work. And that is why at the end of all this process, the individual is immune deficient. HIV is preventable, but it's not curable. It doesn't mean that everybody who is infected is going to die. It's the same way that when we talk about cancer, we say cancer is not curable in the way that I cannot tell the patient you are cured. But the patients with cancer may have lifetime remissions. And in this case, we have the same. There are a lot of patients around the world because the progression of the pharmaco industry, the new medications, and people who really have a healthy life and they follow also the treatment, we have lifetime remissions in which the individual, the viral particles are minimal and sometimes not detectable in the individual. It doesn't mean that that individual can abandon treatment. They have to keep following up with the doctor, they have to keep following up with the test, they have to keep following up with the treatment. So there is not a life sentence or a death sentence like in the past. There are different names that in the past we used to call these infections. Human T-cell lymphocytic virus, lymphadenopathy-associated virus, and why? Because individuals infected with HIV, usually they have nodes, lymph nodes, and that's why it was called lymphadenopathy-associated virus. And well, AIDS-associated retrovirus, ARV. The most common we know is HIV, when it's the first part of the infection, and AIDS, which is the terminal illness caused by the infection. This is the difference in between HIV and AIDS. Individual who is HIV positive is just infected by the virus. And if the infection progresses, the last term of the infection is AIDS. At that point, the individual is deeply affected, and of course, there are other issues that will occur, like opportunistic infections, some type of cancers, and at the end, of course, the individual will die victim of all these consequences of the immune deficiency. As I say, it's a predisposition. Individuals who are really affected will have opportunistic infection. What is an opportunistic infection? Infection that commonly we don't affect us when our immune system is okay. But as soon as we are down, and not necessarily for HIV, you will hear opportunistic infections in a lot of patients that they are not HIV positive. When you have a long treatment with antibiotics, you are at risk of opportunistic infections. When you are depressed, your immune system can be depressed, you can have opportunistic infections. When you have mononucleosis, the immune system gets depressed, you can have opportunistic infections. individuals who are alcoholic and with malnutrition, malnourishment, they can have opportunistic infections. So not only individuals with HIV will have opportunistic infections. Patients with cancer during the chemotherapy can have opportunistic infection. Chemotherapy and radiation therapy will depress the immune system. Elders, they can have depression of the immune system. They are at risk of opportunistic infections. This is a very specific explanation about the genetic of the virus that really is not our objective. In this diagram, what we see is how the virus, enters the cell and starts disrupting the cell, all the functions of the cell, and that cell becomes null, so cannot work. It is interesting how, when we analyze the transmission, you see that we say silence, ignorance, fear, stigma, and discrimination. And you say, but how these terms can be related to transmission? Very simple. If somebody is infected and doesn't say that is infected, if you don't know that you are infected, if you are afraid to be infected and you never test yourself, the stigma from the society that, oh, somebody is HIV positive, I don't want to have something to do with that person. And the discrimination that, yes, it exists. With patients with HIV, creates a cycle that people, some people they don't know, some people they don't want to know, some people they know but they don't tell. And the three categories will increase the risk of dissemination of the virus. Blood products, semen, vaginal fluids are the most common carriers of the HIV virus in terms of infection. Drug abuse, specifically intravenous, people who use needles or blades, whatever sharp object infected with blood that has the virus is a potential carrier of the infection. Unprotected intercourse, oral or anal or vaginal. Mothers infected with HIV will pass the virus to the baby during the pregnancy, because the virus will trespass the barrier of the placenta. But also during the birth, during the delivery of the baby, there is also a huge contamination if the mother is infected, because during the labor, the pass of blood from mother to baby is huge during the contractions of the delivery. So that is why it's before birth and during birth. Now, the natural course of HIV is from the beginning of the infection. The patient will have some mild symptoms, like a flu-like symptoms, and then from there will have a period that may last up to 10 years, where the individual can be asymptomatic, no symptoms, nothing, but the virus is there, and that individual can infect other people. And if the individual is tested, of course, it will test positive. Now, along these years, the immune system gets more deteriorated, and at the end appears opportunistic infections and some type of cancers, specifically related to the immune system, lymphoma, some type of leukemia, and Kaposi sarcoma that is also related to the immune cells. Here is this picture of a lesion that is a Kaposi sarcoma. The most frequent infections, opportunistic infections, we see in terminal patients with AIDS, bacterial, tuberculosis, herpes, candidiasis, which is monilias, the higher leukoplakia, which is lesions that appears in the skin, and the Kaposi sarcoma. Also, we have pneumonias by pneumocystic, toxoplasmosis, cryptococcosis. You see all these infections that normally you don't hear that happens around, but yes, we can see in individuals that are immune deficient. And non-Hodgkin lymphoma, which is a tumor expenses to the cells of the immune system. This is also other things that we can see in the last stage of HIV, so the AIDS, the dissemination of bacteria, histoplasmosis, the rhinitis lymphoma, and even what we call HIV dementia that is caused by the inflammation of the central nervous system. When these infections, they affect the central nervous system and also what is called progressive multifocal leukoencephalopathy, which is affecting directly the brain. Pronounce
that again.
Yeah.
Pronounce that word again.
Lympholeukoencephalopathy. It's patches that in the brain you will see patches of white tissues, tumoral tissues that will affect all the brain around. Yeah. I remember when we didn't know what was going on because unfortunately they didn't disseminate the information. I was doing pathology and we conduct a lot of autopsies with patients that die with AIDS, but we didn't know what happened. So we saw all these changes in the brain, we saw all these infections attacking the body, but we didn't have an idea that what was going on until, of course, they disseminate information that there was a retrovirus affecting the immune system and was causing all these issues. But there was a period of time that we didn't know what was going on. There are different categories of patients according to the population of T cells. We really will not go into details of this because this is very medical. I mean, it's more important for us to remember that tuberculosis is one of the most frequent issues that may happen in those patients. And there are around 10 million patients co-infected with tuberculosis around the world because they are AIDS patients, and because the immune suppression make these patients exposed to be infected by the tuberculosis bacillus. There are different options to be tested. The normal test that we know that is conducted by blood, those tests are anonymous. Only the patient will know the result. Even we know that it's a reportable issue. These are the different, the different lab work that we have to conduct for those tests, different methods of lab work. There is a test in urine that is not that effective. Basically, we don't like that test because I have a lot of false positives. And it's not recommended by the FDA, it's not recommended by practitioners because the number of false positives that may have. And the oral one that is FDA approved, but anyway, it's blood, because in the oral test, what we take is blood from the gums. It's not saliva, it's blood. There are different treatment options. I will not go in detail because, again, this is very medical. But the treatments that we have now are very effective. And what do? They attack the virus in a way that they will block the ability of the virus to survive in the cells. There are a lot of enzymes that are necessary for the virus to survive, to incorporate in the metabolism of the cell, and these treatments, what they do is they block that pathway. These are the names of the medications that we have now. And recommendations for HIV positive individuals. Follow the treatment, follow the appointments, have the PPD tuberculosis test, immunizations for all those that they can be vaccinated, and of course, try to follow all the precautions to avoid these opportunistic infections. Prevention is the best that we can do, from abstinence, monogamous relationships, protected sex, sterile needles, of course that in healthcare we always use sterile needles, and don't share toothbrushes or blades or razors. Those are very personal, and them could be a source of infection. So no sex, and not intravenous drug use. So monogamous relationship, if you have a partner that you trust, but has to be mutual trust. Use condoms and use barriers. And you see how the epidemic is going up. We are here. 3%. North America. You see how common is in the sub-Saharan Africa, so south of Sahara Desert. The south of Asia, those are the leaders in the infection. But Oceania is Australia and the islands around Australia. We assume that the issue is bigger, but it's underreported because we don't know everybody who is infected. Not everybody is reported, and then it causes, bias in the statistic. So there are government organizations that they help to prevention and treatment of HIV and AIDS. And the way we can help is following the prevention rules. The patients who live with AIDS and HIV, they are recommended to have a healthy life, to combat depression, and follow treatment. These are recommendations from the Center of Disease Control. I mean, be tested, follow the rules of prevention, and avoid high-risk behaviors, such as use of intravenous drug, unprotected sex. This is a rapid HIV screen that it can be conducted, but of course, if it's positive, has to be confirmed by a regular HIV test. Questions?